So I'm the program manager for the Starzl Network, and that means I do a little bit of everything. And when it comes to the programming, I help a lot with the pilot projects, organizing their calls, and making sure they're staying on task in the surgeons working group. And as of late, as we get up and running, I've been doing a lot with the legal agreements and identifying our data coordinating center. So I grew up in a really small town and there wasn't a lot, but the community had its own cancer coalition. It was called CPAC, and it was a group of about 6 ladies. My mom helped them a little bit as she's a medical provider locally. And I kind of learned a lot from them, expanded to American Cancer Society and a few other organizations. And my senior project in high school was raising money for St. Jude Children's Research Hospital. So it's just something, I love volunteering. I've parked cars, I've helped with websites, I've filed paperwork, I've played with children, and all of it, and it's so much fun. Right out of high school, I wanted to work in a lab and do bench work and research, and I pursued that as an undergraduate and got my degree in genetic engineering. And then decided the lab wasn't quite for me, but didn't want to give up on the science and got a master's in public health here at the University of Pittsburgh, still with a focus in human genetics. And so I knew I wanted to incorporate science, but also my love for nonprofits. I've been volunteering with nonprofits since I was 12, very consistently part of a volunteer community service fraternity in college, and just something I'm really passionate about. So I started working at a cancer nonprofit, and I learned a lot about nonprofit management and program management and built up a lot of skills. So then when I heard about the Starzl Network getting up and running, I was really excited to get in at the beginning and start at that ground level and really be able to build something with those skills and with the Starzl Network's goals, and the passion behind it and the support for it is remarkable. I love everyone's passion and commitment to the network. So coming in, I didn't know if we had buy-in from all of those centers and from the parents and all those people that we needed to be successful. And everyone's willingness to share their strengths, their weaknesses, and being so candid to help children and help transplant outcomes has been amazing. And I've learned just as much from our patients and our families as I have from the surgeons and physicians as well. The thing I'm looking forward to the most with the network is when we get up and running to share data and outcomes and really start to drive change in best practices. Reaching out peer to peer, I have a hard case, I have a question, I need help, and everyone's been very responsive to that. And it's something you don't see a lot in the scientific and medical communities all the time, so it's very refreshing to see that transplant is a small, strong, thriving network.